Good morning, everybody. Welcome to another great decision session. We're happy to have you here. Of course, we're going to be talking about the pandemic and international organizations' response to it. And our conversation about the pandemic will continue, of course, on Thursday, when we'll feature John Micklethwaite, who is the editor-in-chief of Bloomberg News, and Adrian Wooldridge, who's a writer at The Economist, and they're going to be talking about their new book, The Wake Up Call, which is looking at all the weaknesses in the West that have allowed this virus to proliferate and what we need to do about it in response. A couple other really quick little points. We've just confirmed that we will have Fiona Hill on our live stream program on April the 8th. So that will be a good one. And then we have a couple other announcements around our Russia disruption series. Additionally, and we'll feature the lawyer, for example, Jameson Firestone, who, for those of you who read Notice, know has played quite a role in Russian accountability, let's call it. So that is all coming up. But this Thursday, it's going to be a really interesting conversation with John and Adrian. And we're super lucky to have people such as today's speaker, Jim Falk, who I'll introduce in a second, who are, making the key introductions to us to get to some of these speakers to bring these programs to you. So let me now bring in Jim. And Jim, good morning. It's great to see you.
Good to see you. I just wish I were in Santa Fe.
Well, that's in the works, as I understand.
It is indeed in the works. I'm so pleased to be on the board, to be invited to be on your board, and look forward to meeting all the members. To be perfectly candid, our house is on the market. If any of you are looking for a second home in Dallas, Texas, come here, and I'll be in Santa Fe even quicker. And don't forget the program tomorrow night that we're co-sponsoring.
That's right. Yeah, let's talk about that for a second, Jim. So there's Joey Warwick from the Washington Post, who's just written a fabulous book on Syria, and he'll be speaking in or with you in Dallas. So I don't know if anything's in anything anymore, but you'll be speaking with him. Tell us a little bit about Joby tomorrow night.
Well, Joby Warwick has written this book called The Red Line. Where is my book? There it is. Let me reach over and get it. And Joby won the Pulitzer a few years ago for his book, Black Flags. And I really found this book interesting because he focuses on, obviously, when President Obama said, drew the red line. And of course, we did, he moved away from the red line. But the chemical weapons that the Assad regime had were destroyed. And how they were destroyed is really a fascinating story of American grit. Some naval officers and others who actually destroyed them on a boat that was reconfigured. And then Joby also talks a lot about where we are with Syria, Russia's involvement. And I won't miss the opportunity to talk with them about what happened last week when the Biden administration for the first time used its military arms.
Right.
So I hope people will join. And as you're probably about to say, I'm the former president of the World Affairs Council of Dallas-Fort Worth, and it's fun for us to collaborate on a program.
Agreed, and fun for me to welcome in one of my peers into our board of directors, and we're really thrilled to have you here with us, Jim. So just before we dive into today's program, a reminder to all of you out there that this is a Zoom meeting, not a webinar. And so I really want to hear from you. I want your comments, your reflections, your questions, and so on. So Jim is going to present for a little bit about the chapter in the book. I've got a couple things to say about it, given that I worked with WHO for about 8 years. And then, there's a couple different ways for you to be part of the conversation. First of all, you can raise your hand. I had to kind of dig around on my screen to find where the raise hand button is. It's there. If you can't find the raise hand button, just type into the chat window, "My hand is raised," and I'll come to you. And by coming to you, that would be, let's unmute you. Even better, let's see you. So if you want to say something, just be sure that there's not a vacuum cleaner running in the background or dogs barking mercilessly, because you'll treat us all to those noises. But honestly, this is about having a great discussion. So raise your hand, type into chat. You can even put a question into the chat window if you prefer not to be seen or heard. But I'd love to see and hear you. So let's see and hear you. So Jim, let me turn it over to you, and then I'll kind of pipe in when the time comes.
Super. Well, first, I have to say, Sandy, you put me on the spot. My goodness, when I volunteered to do this topic because I thought it'd be really something interesting and I wanted to learn about it, I'd forgotten that you had been a contractor and worked with the World Health Organization for a number of years. So, way to sandbag me. But I'm glad to have you there, and I know you're going to pipe up. And let me encourage everyone to indeed be part of the conversation. One of the things that I really have always enjoyed about Great Decisions is it does give all of us an opportunity to dive in a little bit more deeply into subjects that we may know something about or not know a lot about. And I studied international organizations at the University of Virginia as part of my graduate work a long time ago. So it was great fun to sort of catch up and see what was happening. And really, in a very large sense, the criticism as well as the accolades that have been directed to the World Health Organization are very similar to what happens with other UN agencies because they're all so dependent on the whim of the member states, and they do not have a lot of flexibility or, to use a popular word, very much sovereignty in their own neighborhood. Um, and it's also a situation with the World Health Organization in particular that its successes are probably not very well known, but its failures make front page news, especially over the last few years. Uh, One reason, of course, is we had a president, President Trump, and his administration, who from the outset made it pretty clear that it was America alone, not supportive of alliances or multilateral, multinational organizations such as UNESCO or really anything attached to the United Nations or NATO, for instance, as well. And then, of course, COVID-19, that was really put, in a sense, a nail that into WHO's coffin from the perspective of the U.S. administration. Um, and then the other thing that really played a large role was the growing um, influence and really desire of China to play a role, a larger role, a role that heretofore it had pretty much ignored, had not taken, and that was to be much more active in international organizations. And power speaks. And so organizations like the WHO had to pay more attention to China's wishes than it had to in the past. Um, as we know, the Trump administration withdrew from WHO. It was certainly a political act, and that was a really serious blow to the organization. And I'll get to this in a moment because the United States is the major donor to the WHO. One of the first acts that President Biden did, really on his first day in office, and let me see if I can just pop up this letter. Let's see if I can do that. Screen share. And here's this letter. There we go. I hope you all are seeing that. This is the letter that President Biden sent on January 20th, the date of his inauguration, to the Secretary General of the UN, expressing the desire of the United States to step back as a member of the WHO. One thing to know is that the WHO is a legacy organization that traces its roots back to the League of Nations. And I think it's good to remember that one of the reasons that it was viewed as being important was because after the pandemic of 1918, also known not correctly as the Spanish flu, um, and so much of the work that the WHO did from the very beginning was focused on pandemics. And I guess that's one of the things that struck me in reading this material and other articles that I read in preparation is just how many pandemics there have been throughout our history. Uh, Nothing like the 1918 or COVID-19, but there have been other pandemics such as SARS and even Ebola. And I suspect that that Sandy will be able to bring more into about that. Um, in 1947, WHO established what was called the Global Influenza Program, and it was really very, very successful in advising other countries about how to handle the flu or other similar type of pandemics. And one of the things that the WHO has been able to do very well is that it has been a convener. It has some of the, and it always has had some of the most outstanding epidemiologists, biologists, physicians working there in Geneva or at its other offices. And while in the United States we have in Atlanta the Center for Disease Control, many developing countries, emerging nations, don't have either the expertise or the funding to mount their own organizations like a CDC. And so the WHO has been able to set standards and provide very quickly guidance on various health matters. One area, though, that makes this, has really hamstrung, has handicapped the WHO, not unlike other United Nations agencies, is its budget. And what I found surprising, and I realized I didn't understand this, I always hear the United States is the major donor to peacekeeping missions or to the United Nations. But I did not know how that allocation was calculated because China, for instance, gives very, very little to the WHO or other United Nations agencies compared to the United States. And we know that China is certainly now not a developing country. And maybe Sandy in his remarks can help us understand this a bit better. But what I saw, one, when I started looking into this, that all the articles begin by saying, the budget for the United Nations and its agencies is very complex and is difficult to understand. Yes, now I understand that, I agree. But it's basically calculated on a per capita income of the citizens. So thus, the United States has a much higher assessment than say China. Looking at specifically the budget of the WHO, it's calculated or put in place, set every 2 years, and it's only about $2.5 billion annually. So how does that compare to some other organizations? Massachusetts General Hospital is 1 billion. MD Anderson in Houston, its annual budget is 5 billion. The CDC budget is the budget of WHO is only a quarter of the annual budget of the CDC in Atlanta. Another key part when we're thinking about the budget is that only 20% of WHO's budget comes from assessed fees. The balance, some 80%, comes from voluntary assessments. And these voluntary assessments, for those of you who have served on nonprofit boards or have been with nonprofits, you understand the term restricted. These are restricted, they're for specific programs. And so when you have an emergency, a crisis, like what we've experienced in the last now 13 months with COVID-19, those funds are not accessible to the organization, and they had to go and raise additional funds. So that really puts the organization at a disadvantage and also makes it more highly politicized. The Gates Foundation gives 9% of the total budget to WHO. The Rotary International gives 4%. The United States government pays about 22% of the assessed contributions, and 65% of WHO's funding comes from just 15 donors. So you can imagine just how that really puts it at a large disadvantage in managing its own affairs. The WHO is also highly decentralized, and this was surprising to me. I know that its headquarters are in Geneva, but that I was not really understanding that it has 6 regional offices, and then 6 regional hubs rather, and about 150 different offices. And there is a lot of infighting, bureaucratic infighting for resources, staff, and money among all these hubs and the different offices. So that even makes it more challenging. What can the WHO do, and what has it done in the past? Its major activity that it can do is that it can declare what's called fake. And I did not know how to pronounce that till I heard it on a podcast. Fake actually stands for PHEIC, Public Health Emergency of International Concern. Sort of an ambiguous term, isn't it? But that's what the Secretary General, the chief executive officer of the WHO can do to mobilize international support, international awareness when there is a medical crisis such as COVID-19. It has not done this very often. It has only declared a fake 6 times. For H1N1 in 2009, for polio, the rise again in polio in 2014 and 2018, Zika in 2015, and most recently, COVID-19. The Secretary General of WHO and the council that advises him is very, I think, safe to say, very tenuous, timid sometimes about declaring fakes, because it does become, a big issue. It's lots of publicity and certainly can drive different not sanctions, but traffic, international traffic, international travel. So it can create quite a crisis for the country that is facing this healthcare emergency. Let's talk just briefly, and then I'd like to bring in Sandy, about what happened. Should China, I guess the question we could say is, did the WHO react appropriately with COVID-19? And like many things, there are two sides of the story. One thing that I think we need to realize is that the Secretary General of the WHO, a gentleman from Ethiopia who had been Minister of Foreign Affairs, Minister of Health, and by all accounts is highly qualified, does not come from a powerful country. And he probably was quite reluctant and, again, very timid in how he handled it. From what I've read in most cases, I don't think China really exerted a great deal of influence on WHO's reaction, but China certainly did not open up its country early enough to the pandemic, and there was significant pressure coming from on the Secretary General not to declare a fake in the initial few days of when COVID became more widely known. WHO was notified early on January 2nd that there was an outbreak, but it took several days for a meeting to be convened. And then it was not until January 22nd that WHO convened an emergency session, and then the so-called fake was not declared until January 30. And then COVID was not identified as a pandemic, a global pandemic, until March 11th. And as all of us know on this call, just like the CDC has given mixed messages, the WHO is equally culpable in that area, whether or not it was COVID-19 could be spread as an airborne transmission, or whether or not you should wear a mask or not. And one of the reasons that the decision was not made publicly that we should all be wearing masks was because they were very concerned about the supply chain. when I look in sort of to summarize, I think that WHO has been constrained in its activities, like many UN organizations, by being asked to do too much with too little resources. It cannot act independently. It is essentially at the beck and whim of the member nations. It has been caught in the situation, the rivalry and influence between China and the United States, which has only increased in the last 5, 6 years. And it is really short of resources. Um, I do believe, as the article pointed out, that if WHO did not exist, we'd have to come up with another organization along the same lines. Um, I think there's certainly an argument to be made that we'd be better served if the organization had perhaps an independent body of scientists, physicians, even and business people and diplomats that worked outside of the sort of member state paradigm to advise and manage some of the health issues, because as we look forward, the world is only getting smaller, and sadly, COVID-19. I think one thing we can all agree on will not be the last pandemic. Other international organizations beyond the WHO have played a critical role and have not gotten a lot of publicity. The World Bank, for instance, has provided emergency funding to nations that found themselves severely hampered by cutback in tourism, as well as other economic activities. The IMF has provided some flexibility on their repayment schedules. We've also seen how the vaccine has been helped, the distribution of the vaccine and other PPE has been assisted by NATO, who has provided transportation. So many international organizations have helped support the world through their activities in light of COVID-19. So I've talked for about 15 minutes or so, and so now I'd like to see what holes Sandy said I missed, and then we'll open it up if that works for you, Sandy.
Perfect. Thanks, Jim. I don't think there are any holes there whatsoever. I'm going to say a couple of things, and then I've got a couple of images I want to show. But please, folks, get your comments together. I'd love to broaden out this discussion. So, for me personally, I'm a huge believer in the tragedy of the commons. I think I could put many of you into that camp, with the ultimate understanding that global governance is required on some of these many big issues. There's a great New York Times article this morning on vaccine diplomacy that says, quote, "The pandemic will not be vanquished anywhere until it is vanquished everywhere." And I think that kind of sentiment really lies at the basis of WHO. And, certainly it has some flaws, and I want to talk about those in a second, but ultimately it's responding to things that only a global body can, because, the way our current global system is set up, countries look after themselves first. And obviously when we have a health issue, like a pandemic or like Ebola, borders are not respected. So I'm a really strong believer in WHO. I worked as a consultant for about 8 years with various different facets and aspects of WHO in Geneva, obviously in the headquarters, which is an amazing place full of people from all around the world, super smart folks working on all kinds of different issues. And then I worked at the regional office in Copenhagen, which is obviously the office for Europe, when I did a lot of work on Eastern European countries. And then in Brazzaville, which is in the Republic of Congo, which obviously does a whole bunch of different things for the African continent. So a couple of the really good things that WHO does. The first one, and Jim mentioned this, it has an incredible convening power. And I want you all to just step out of your, American shoes for a second, and slip on your shoes in Sierra Leone or Zambia or Bangladesh. most of these countries don't have a National Institutes for Health, don't have a Centers for Disease Control, don't have a national health authority that can bring together, scientists conducting research on particular problems and then figuring out what needs to be done at a practitioner level. And WHO fills that void, and it does it extremely well. A lot of the work that I've participated in Africa was about networking, about saying, well, this particular country has figured out some major roadblocks in rolling out their antiretroviral therapy, and what can this country learn about, what has happened in those countries or in a different country. And so that sense of networking, that sense of, bringing in the greater good or the collective good for an individual or an individual country benefit is extremely powerful and really important. And always the funny thing about the convening power in going to the country office where the CR sits, the CR is the country representative, almost always from a different country, if that makes sense. So if we're going to the country office in Zambia, we're not going to be meeting a Zambian who's the country representative. It'll be somebody from a different country, again, to emphasize that networking component. But going to those meetings, people I would never have seen wearing a suit and tie before would suddenly show up in a suit and tie because, a meeting at WHO really means something. It has a great value. So that convening power and that transfer of knowledge and sharing of knowledge is a key component for poor countries in particular. And it's also an ability to access global best practice. So, coronavirus has about 1 billion different things we need to be thinking about, but for a poor country to be able to call upon, this body of knowledge globally via WHO is extremely important. One of the things that I worked on, and I'm going to just click over to an image here to show you, which I think is something really interesting that that WHO does, is a lot of intellectual leadership. So one thing that came out, soon to be 20 years ago, was, we're always talking about strengthening health systems. We need to strengthen the health system. You can't just pump in tens of millions of dollars to fight HIV/AIDS, because how are you going to spend that money? Where does it go? And we saw in many instances parallel systems set up by, for example, the United States and its PEPFAR program, where instead of investing in the health system in a country ravaged by HIV, PEPFAR, and I'm not pointing the blame only at PEPFAR, but entities like PEPFAR or even the Gates Foundation would set up parallel health systems, training specific healthcare workers to deliver a particular intervention to a particular population in a certain way. Those kinds of parallel efforts don't ultimately help. They may be a nice small-term, short-term Band-Aid, but they don't affect the deeper problems and malaise within the system. And so this is a graphic that actually, this is in a book called Systems Thinking for Health System Strengthening, which I was one of the authors on now about 12 years ago. But this gives a really good idea of what in the world a health system is. And so, health systems obviously very complicated, but when you kind of pick these major points, you can start to see the ways in which a health system functions. And so people are obviously at the core of a health system, but then these 6 other components are all extremely important. Obviously, information is massively important. We're seeing in the pandemic right now how incredibly important information generated at the hospital level, and that information goes to the CDC so that the CDC can then, put together the patterns and understand the full shape and extent of the pandemic. But that's not going to happen unless there are information streams that are open between, for example, the hospital level and the government. And this is complicated. How do you make sure, a clinic in a rural village has the ability to transmit its information about what its levels of supplies are and what new supplies it might need? Complicated things, but extremely important. The system functions on information. Financing, that's a whole other conversation and a big conversation, but obviously, especially looking at African health systems, the way in which they're financed is extremely important. The United States, of course, has a health system that I'm not sure you could design one more complex and opaque and honestly as underperforming as it is if you tried. And a lot of that comes from the financing model here, which is ultimately, surrendering, the financial control to private insurers. And you really not find another health system like it anywhere else in the world. Service delivery encompasses, the roles of doctors and nurses and frontline workers and so on, and all the training and information and leverage that group within the health system needs. Human resources, not just those who deliver services, but all the other folks that are involved in the health system. One of the amazing facts I heard, a few years ago was that in the United States health system, 30% of all human resources are dedicated to billing and insurance, which just shows you again how some of the allocation within the United States health system is not optimal, let's call it. Medicines and technologies, obviously that is massively important. And understanding the flow of medicines and technologies, understanding how to uptake a new medicine and technology, extremely important. And that, of course, brings us to governance and how the system functions and how there's accountability in the system or not. We've seen lots of instances of corruption, of dollars going to places where they shouldn't go. But anyway, the larger point I want to say about all this, and obviously I could talk about health systems for a few hours on end, is WHO illuminates all of this and helps countries understand what is a health system and where are they performing well and what do they need to do in order to perform better. And these circles are all interconnected. You can't just focus all your money on information flows, because then you're not going to have the medicines and technologies or the trained personnel to deliver them. So they're all incredibly important. And WHO has a great intellectual ability to help people understand that and help to direct resources appropriately. When we turn to the recent pandemic of Ebola hitting West African nations in 2014 and onwards, I think we saw very much how these six elements of a health system in those countries were really paid attention to. There was no quick fix for it. It was an emergency measure. But a lot of the things that happened because of WHO's response to it and directing funding to that epidemic were really quite exemplary. So a couple bad issues, a couple things for improvement for WHO, and the article touches on some of these. And it actually names what I saw routinely as the #1 flaw in WHO's system, which is that the high-level positions are all filled by physicians. Now, for those of you who are out there who are physicians, I apologize, but physicians are not trained in the arts of management. And ultimately, in WHO, and I have another graphic I'm going to put on screen, it is a huge bureaucracy. And therefore, there has to be people who are really good at managing people. And I saw again and again and again, the inabilities of doctors to really take over and know how to run. So this is too small to see in detail, but this is basically an organogram of WHO from the DG on down. And the thing I like about the way it's set up is that they have different pillars that focus on different things that are all obviously of great importance and require a great amount of specialization. I did actually a fair number of work for this cluster on access to medicines and health products. So it's intensely bureaucratic. It is staffed overly by doctors and physicians. And then the next point, and the article touches on this to a degree, because funding flows are erratic, a lot of people are working for where the money is, as opposed to where the health need might be. And so, at least in my experience, there was often the feeling of, oh my goodness, the ship is going down. Where can we scamper to in order to ensure we have resources coming to fund our particular work? And like many bureaucracies, it's constantly reinventing itself and figuring out where to go next and all of that, which is not necessarily a bad thing, but the transactional cost of reorganization is extremely high.
Sandy, can I interject and ask you a question here? What type of turnover is there? The Director General serves for 5 years. It can be renewed for another 5-year term. Do people work for him, or are they civil servants attached to the WHO?
I think there's a lot of different arrangements of how staff are there. For example, the new blood that comes into to the WHO system every donor country is allowed to fund a number of positions of their nationals working at WHO. So there's an overrepresentation of wealthy countries in the actual WHO, simply because donors essentially buy the privilege of allowing their staff to go there. But in terms of other arrangements, I'm not sure. I'm not sure what the politics are behind it. In some cases, it's certainly the best person to do the job is there. In other cases, there's certainly some nepotism, or certainly some ways of, kind of bending the rules to get, your preferred candidate installed.
And people are very well compensated.
Well, yeah, compensation's good and the perks are really good. And that's sort of my next issue. That's just a bizarre one, is because WHO is the global authority on health issues, you who are running, a conference in Kuala Lumpur, and you really want WHO to come and offer its perspective on it, and you get people, staff members in Geneva who will fly business class, to give a 45-minute presentation in Kuala Lumpur and then fly back home. And I really hope that those kinds of arrangements have changed and shifted, because that's just a tremendous amount of money to spend on something that's absolutely unnecessary. But those kinds of perks, that kind of, level of professional, person, in my mind, shouldn't be doing those kinds of things. And the WHO has many different arms and many different abilities to respond to the kinds of opportunities where their perspective is really
important. I remember when I lived in North Africa, the head of the WHO office had a bigger home than the American ambassador or the French ambassador.
Right. Yeah, I mean, it's certainly a prestigious position, and rightly so on the one hand, but on the other hand, we need to really focus on the task at hand and ensuring that that resources are spent appropriately. So now, having just sort of laid out from my personal perspective some of the good things and some of the not so good things, the next question is obviously, well, how do you reform WHO, and what needs to happen in the reform process? And and I think that's a great question. I have no answers for that whatsoever beyond, and I think the article did a decent job of presenting some of the points of the non-papers, or the non-white papers, which is an odd term.
That was a weird term.
Really strange term. But yeah, I mean, there's lots to talk about with WHO. Those are kind of some of the things I thought might be interesting to discuss today. But the floor is open for folks. Philippa has entered a comment here talking about how term limits could certainly help. And she's surprised that the Director General served for 10 years and was from China. This is Chen, and there's a question of whether the DG has too much influence or not enough influence. It's extremely difficult, and I think the article does a good job of pointing out that WHO may be the global health authority, but because it can't step on people's toes, and because it doesn't want to alienate or anger its donors, it's restricted from kind of doing the things it needs to do, especially in the face of a spreading pandemic.
And let me note that I stumbled and I said Secretary General, and it's the Director General.
Yes.
Yeah. And one of the things that I read, I'm not sure if it was in the article or in maybe the Council on Foreign Relations put out a very good backgrounder. When was that updated? January 29th, 2021. So you can just go to Council on Foreign Relations site, and it's an article called "What Does the World Health Organization Do?" But they talked about, one of the articles about the Director General who came from Norway. Pronounce her last name for me, Sandy.
It's Brundtland or Gruntland.
Yeah, Harlem Brundtland.
Yeah.
And she was known to be quite a dynamo, and basically just bulldozed over everyone, and was considered very successful because she didn't really go through the bureaucracy and was able to mobilize WHO in a way that many of the other director generals were unable to do.
Yep. Well, folks,
what do you think about China? I mean, Sandy, did China exert a great deal of influence in the beginning of COVID-19, in your view, or did WHO do what it could do?
In my view, I think WHO decided not to be as forthcoming about what it was learning, but also its information flow from China was extremely restricted, and so it was limited in what it could actually do. but I think everyone's worried about antagonizing China. And given Chinese centrality or centralization of information and protection of information, I think WHO was an extremely difficult spot in order to know what to do. I have a hard time believing the kind of more conspiracy-minded folks who have all kinds of different things to say about what China may or may not have done. But from purely a WHO perspective, I'm not sure what it could have done that much differently other than being much more explicit about banning international travel or recommending the banning of international travel. And I'm really not sure why WHO did not insist on a mask mandate earlier on.
Well, on the international travel, all along, WHO has said that they don't want to do that because that has such dire consequences, especially on developing countries where many of these outbreaks have evolved from. And it would be such a dramatic blow to their economy. And it's so hard to really uh, isolate these countries, quarantine these countries. So typically, WHO has been against any type of travel restrictions.
Right. I certainly hope one of the lessons that comes out of all of this is that when there's something highly contagious that obviously threatens not only the people's health but also our livelihood, given how intensely interconnected the global economy is, that WHO can be a bit more proactive in terms of saying, here's what we know and here's what we don't know, and we are making the following recommendations. And again, WHO doesn't have any authority to say you must do this or that, but it does have that convening power to say, in the light of all this uncertainty, here's what we think is the best path for you as an individual, for you as a country, and for all of us as a community of countries to do. And that kind of element I haven't seen too much in the response to the coronavirus.
Well, that's interesting what Herb said about what a non-paper is.
Yeah. Conveys what a government wants to convey, but it's unofficial and possibly deniable.
Thanks, Herb.
I wonder, why don't we just call it a black paper instead of a white paper?
Sandy, Chuck has raised his hand, has something to say, I think.
Sounds good, Chuck. I'll ask you to unmute and turn on your video as well. We can hear you now, Chuck.
I'm coming.
Voila.
Hey, Chuck.
All right. I thought it was very interesting in the article with where Jim just mentioned the Director General. I think it was 2000.
Chuck, I can't hear you. Can other people hear you well? It's
It went a bit low.
Oh, I'm not sure how to make it higher.
Just speak louder, I guess.
Okay, I'll try. It was interesting that as Jim mentioned, the Director General from 2003 and what she did and got a lot done, and people didn't like it, that the outcome of that was that they said, great job, just don't do it again.
Yeah.
And the problem, I think, that part of the issue here is that we always end up with what we really want. And if the member countries don't want somebody to take control or really manage things like that, it's going to be nearly impossible, I think. Just like the UN struggles when the special interests of some of the members can get in the way of their being effective. So it comes back to, how does a consensus organization like this get anything done effectively when the special interest can step in and stop the process?
Well, it's a great question. I don't know how a consensus organization, given the massive amounts of money in health, and then obviously the different perspectives on what needs to be done, as this country illustrated for the last year under the Trump administration, I don't know how it gets anything done. And in some ways, I wish WHO would just focus on providing recommendation that's non-binding. You as a country can do with it as you see fit. But from where we sit, this is what we think is the best thing to do. And obviously, there are disincentives for WHO to respond like that.
Well, also, as you said, Sandy, I mean, we can't even get a consensus in our own country on how we should have handled COVID-19. Um, I think one of the things too, and I'd like to get your thoughts on this, Sandy, is again what I read was that WHO was its origins and its purpose really made a lot of sense, but over the last, especially 15, 20 years, its mission has broadened so much, and part of it is because of the UN Sustainable Goals. I mean, they were trying to meet those. How do you get the WHO back to where it should concentrate on what's really critical?
Well, I don't know. I mean, where do you even begin with what's critical? There's so many different arguments to be made for this is critical or this is critical or this is non-critical. Obviously, pandemic response is a massively important area. And let's not forget that's what the CDC's mandate was from the very beginning, was to help, the American public deal with a pandemic. It had been waiting for almost 100 years for its moment with coronavirus, and then for reasons in and also beyond its control, were unable to rise to that moment. So, I mean, I think certainly looking at pandemic control would be one thing I absolutely think WHO needs to keep doing and do a better job of and have a freer hand to do. And the second thing, would really be to continue providing expertise, networking, technical support to countries that are looking at ways of really strengthening their entire health system. That graphic I showed that had the 6 different kind of buckets of functions for any health system. Each of them is incredibly difficult, and how you go about doing that, and in what kind of phased approach you're going to take, and how much money it takes, extremely hard to kind of weigh that all out. But WHO has to stay a player in that, because in the absence of WHO, I don't know where most of the countries in the world would go to get their guidance on it. And honestly, the more integrated our health systems can be globally, with one health system talking to another, the better we can respond to things like a future pandemic. And I think the intellectual leadership alongside that is also extremely important. It's one thing to fly in doctors and help a country dealing with an Ebola response, but that kind of direct intervention I don't think is in WHO's wheelhouse. That's much better done by nonprofits like Médecins Sans Frontières. But the intellectual leadership, the ability to produce white papers, not non-papers, but actual white papers, or produce actual, guidance on, well, how do you strengthen your information flows in a health system? And then have, an expert or two come in, consult with ministries of health to build those kinds of structures. In my mind, that's just absolutely invaluable and so important, and something that WHO really needs to kind of double down on. But of course, the funding flows are so erratic, and we have how many member governments are overdue in paying their actual dues. How much noise and waves were created by the Trump administration's declaration of withdrawal. How many waves is it gonna take for the United States to come back in as the player it once was? I don't know.
Well, what I've gathered is that the United States is going to be able to get back pretty quickly and have the role that it had previously, which is good news. But the budget does, concern me the way it's calculated. I mean, the fact that we paid, $400, $500 million a year, and so many countries that are obviously wealthy are not. But I know Teresa wants to get into the conversation, but Sandy, what do you think about this balance between what is assessed and then the voluntary contributions?
Yeah, I don't know. That's a tough one. And
Yeah.
it's not just governments too. I don't really want private foundations like the Gates Foundation giving money either. We'll take it. And the Gates Foundation, I think has done a good job in supporting WHO, but this is for governments to fund and not, private philanthropists. I know I'm dreaming and I'm being an idealist and all this, but again, that great quote from this morning, the pandemic will not be vanquished anywhere until it's vanquished everywhere. To me, that just goes right into the seat of what national governments need to do, and therefore national governments need to pay for it. And I think we have had for many years, and Trump was not wrong in some of the things he was saying about NATO, for example, with countries, contributing the, what, 2% of their GDP in dues effectively to NATO. It is time for the United States. It is time for Biden to say to our friends and allies, hey, folks, we're all in this together. Please do your part, because if you don't do your part, we get all kinds of problems and schisms. So I don't know if there's room for WHO to reassess how, member countries donate money, but boy, I would love to see some accountability of nations, stepping forward with their money. Teresa, let me unmute you, and you know the drill of putting on your screen. But Teresa, the floor is yours.
Hi, everyone. I think you addressed it in those last statements. As I followed the Trump administration and some of the radicalism in the decision making in regard to the WHO, I see that some of it could be very well founded, and you spoke to that point, Sandy. But then on the flip side, in thinking about Biden and that administration stepping back into the WHO, and forgive my ignorance, has there been a clear articulation from that administration in how they plan to address these issues that are being discussed in this room and are evident in the response of the coup, so that we can make it a space that is equitable for all governing, and then to meet their financial obligations equitably in regard to that?
I don't know the answer to that. I mean, I think ideally, well, the way I understand it was withdrawal from WHO was very similar to withdrawal from the Paris Accords, in the sense that nothing was really withdrawn. It was more of a statement of intent for absolute and utter political ideological reasons. But that, as far as I understand, the United States hasn't skipped a payment to WHO and hasn't pulled back any of its staff from WHO. I may not be right on that, but I'm not sure that there's been too much of an impact such that reversing it won't be too difficult either. But I'm not really sure. Jim, do you know anything about that?
Yeah, no, I think you're right on that, Sandy. I mean, there was a period of notice and so forth. And, I think if President Trump or former President Trump had not been running for re-election, would not have withdrawn from WHO. I mean, it made great sound bites. And, in fact, I don't know, and I'm not trying to be partisan here, so please forgive me, but I did, watch the President Trump speak on Fox this past Sunday, and I just couldn't believe how he just brought out the old tropes and talked about WHO, and the crowd raised their hands and applauded. So it's still, sadly, a great talking point for that element of the Republican Party or the Tea Party, the Trump Party, to get a lot of attention when he lambasts international organizations.
What can be done then to granularize the conversation enough into sound bites that will help educate the populace who are radicalized in such a way that we can find progress in reformation or transition for the WHO?
I think it's just that classic point that we are all in the same boat. And I think health just does that better than any other issue I can think of. Because this pandemic didn't decide to just stay in the Wuhan area of China. It did as viruses do. And to me, that just emphasizes time and again that there is no one national response to something like this. It has to be a collective response. And I think we saw lots of examples of where this was not a collective response, or not a very good collective response. And, it's awfully tempting to imagine what our numbers of dead would be had we been more collaborative in our efforts. So I don't know. I certainly hope we can leverage this moment into a better understanding of the ways. And I mean, I sound idealistic here, but it's not idealism. It's almost just the way it needs to be. Countries need to get along and understand each other, be able to communicate effectively when it comes to something like this. And I wish it were an easier way to do that, but it just seems to me again and again that this is the terrain that WHO needs to flex its muscles on. And ultimately it comes back to the countries, but just having WHO suggest the ways in which we can be more collaborative about this, to me seems like an area it needs to move into.
And I don't want to be Pollyannish, but this is where the United States needs to and historically had played a leadership role. And back last May, the UK convened what was called the Coronavirus Global Response Summit, and the United States did not even send a representative. And then I guess it was the WHO was trying to issue a communique, or maybe it was the G7. And the Secretary Pompeo insisted that it be called the China virus.
Right.
And the other countries refused to do that. And so the communique was watered down. And I'm not sure if the United States did sign something or not. I don't think they did, but it was watered down. So hopefully with some of the grown-ups back in the room. WHO and CDC, Renee, I will say that we did a program with Fareed Zakaria a few months ago. And one of the things that Fareed said was that it was so damaging for us to pull out of the WHO because the CDC was such a significant partner of the WHO. And Sandy, you may have more to say on that.
I'm sure there are formal memoranda of understanding between CDC and WHO. I know that there are a lot of technical expertise overlaps, and I think CDC places a number of staff at headquarters in Geneva. And as I recall correctly, that was one of the areas in which people were afraid of what the Trump administration had done in terms of ending support for WHO, was that it would also recall the CDC experts sitting in Geneva and then harm the relationship between CDC and WHO. CDC obviously is a very much a cutting edge agency, and we can of course excuse it and forgive it for some political reasons for its inabilities to respond to the pandemic as strongly as it might have liked. But its know-how, its systems, its amazing smart people. And let's face it, these global organizations are filled with really, really smart people, and CDC has a strong role to play in that. So it's a great question. I'm going to pursue a little bit more and figure out what the exact nature of the relationship is, but I know that there is a lot of conversation that happens between CDC and WHO leadership. I know there's a lot of technical staff crossover appointments. I would also guess that there's a number of WHO staff from Geneva that go and spend time with CDC. So there's a lot of that fertilization, and again, a lot of that intellectual, cross fertilization that's so important that does happen. But let's hope, honestly, I would love for CDC to play a much stronger role at WHO because of the amazing strengths that CDC can bring to bear. And I think as well, too, bringing in some of the global mindset to CDC, even though that's not necessarily CDC's mission. But again, health is inherently global by nature, and therefore no agency focused on health can only be looking at American issues. So, let's hope that in the reversal of the Trump administration decision to pull out of WHO, that the collaboration and thick social networks between CDC and WHO can continue and deepen.
And to get back to what Teresa said a moment ago, I think one of the values of organizations like our Santa Fe Council or other councils and like-minded organizations is just to get the word out when you're talking to your network of friends. I learned so much about the WHO over the last few days, getting ready to participate. When you think about the number of activities, polio twice, SARS, malaria, obviously COVID, that they have worked on that have really benefited humanity. If more people know about that, they'll realize that the $400 or $500 million that we allocate makes sense. It's valuable.
Yep.
We all have to be ambassadors for these organizations.
Yep. Well, folks, any other questions or comments out there before we bring this to a close? There's so much to talk about in this area. It's so interesting. There's so much to say. I've always thought that, if you want to understand a country, any country in the world, one of the best ways to do so is to look at its health system. How are people dying in the country? How are people responding to morbidity and mortality? You gain so much understanding about how society functions based on the health and well-being of its population. There's a lot to say about the United States in terms of the health system that is prevalent here, not all of it complementary. And yet, on the other hand, this country leads the world in innovation, in medicine, in technology, in the health sector. Amazing things, no small achievements either. And that kind of does reflect on the United States as a whole. Herb, welcome. I see you. Why don't you go ahead?
Right. I just wanted to say that I've followed the international organizations quite a bit for the State Department. And the United States, depending upon administrations, has had a tendency to nickel and dime everything, both our contribution to the main UN organization and everything else, and to go through all sorts of contortions about things like how much we contribute to peacekeeping operations, or you name it. And sometimes I think we lose track of that old adage that the person who pays the piper calls the tune. Now, there are some specialized agencies where we know this very well, and we contribute heavily because US private and commercial interests have a big interest in what these agencies do. For example, the International Civil Aviation Organization. And there, our ties between the Federal Aviation Administration and ICAO are just as tight as you can imagine. Likewise, between the Coast Guard and the International Maritime Organization. And one of the reasons is big firms like Boeing and so forth want to be able to produce aircraft that meet the specifications that they basically formulated themselves, and then we impose them on the rest of the world. It seems to me that American medical enterprise, such as our pharmaceutical companies and so forth, could have a similar impact on our interest in contributing to WHO. And I'll let it go at that. I think, as Jim was saying, there's a huge difference between administrations. I'm pretty sure the Biden administration knows the value of these organizations and is probably willing to support them across the board to the extent that it can get appropriations from Congress.
Right.
Anyway, those are just some thoughts.
Those are good. Sandy, before we close, especially since you mentioned this, I read and interviewed Ezekiel Emanuel a few months ago, and I'm forgetting the title of his book, but it's basically which country has the best healthcare. And in the book, United States, France, Norway, China, Taiwan, UK, Canada, and it's divided up. I guess there were 14 countries, and you can either listen to my podcast or just check Ezekiel Emanuel and listen to a podcast, or even better, grab the book. And you'll see, just like you said, Sandy, the United States is top of its class in innovation, but really at the bottom, where you talk about general public health and providing healthcare to children. And the country that does the best overall is Taiwan. And Taiwan, we didn't talk about this at all today, but Taiwan, has done very well with COVID. Only 9,000 deaths, I believe, is the number, and yet it does not have full membership with the WHO. It has some type of observer status. So that's an issue we didn't talk about, but something to look at.
Right. Well, in looking at the United States health system, the biggest problem, and one that I'm surprised is regularly not talked about, is that the outcomes here are something like 15 times more expensive than the same outcome in, in Canada or in Norway. We all want to be, have our broken arm attended to, but I don't want to pay 15 times what, somebody in Norway is paying to get that broken arm fixed. And you look at the amount of folks who have to be involved in the health insurance business, how many tens, if not hundreds of thousands of professionals all around this country who are involved in the arcane billing process. I'd rather have those folks working on other things. I feel like there's a real misallocation of their labor in order to basically make this existing health financing arrangement work in this health system. There's lots of ways, there's lots of things to do. There's a role for the private sector in any health system around the world, but the way it's set up here comes at a huge cost to the taxpayer ultimately, where a lot of those monies are going to big corporations that are in the business of running hospitals or in the business of, of creating pharmaceuticals.
The highest salaries are going to the administrators. I know we need to leave, but Christine, how is the Director General selected?
The DG is selected by member states can propose a candidate, and then the executive board will then review those candidates and submit one to the World Health Assembly, the WHO, to ratify or not.
Is it done regionally like the Secretary General is? It's just sort of assumed that there'll be a term for Asia, a term for Europe, and
I think
jump around the world?
I think in general that's the intention, but obviously things change. And having Chan as appointed for 2 sessions, as somebody pointed out earlier, is a little bit different. And we should spread this thing around. We should spread the responsibility, but also the prestige in a lot of ways of running this organization to different corners of the world. And DG can be re-elected just once. So yeah, it's fascinating. We didn't talk about the World Health Assembly at all. It's a big, big deal. I would imagine Geneva basically shuts down when the World Health Assembly comes to town. But it really is, in many ways, a great attempt at, this consensus deliberation at a global level. It's extremely difficult, but I've not participated in a WHA, although I've certainly helped different staff at WHO prepare for the WHA, and it's a really fascinating way for countries to get together and voice their questions and their dissatisfaction with things at a global level, and really negotiate and try to resolve some of these big issues that we're all facing. Well, that's it for me. And Jim, you want to have a last word here and take us out?
Oh, just thank you so much for letting me participate. This is my first activity other than board meetings with the council. And really, again, I hope that many of you can join us tomorrow with my conversation with Joby Warwick, and look forward to meeting you. And if you know anybody who wants to buy a house in Dallas, send them my way. Bye, everybody.
And a great reminder too that on Thursday we'll get into pandemic issues in much more detail, which I'm really looking forward to with John Micklethwaite and Adrian Wood.
Oh yeah, and I interviewed them a few weeks ago, and they are terrific. Do you all know John Micklethwaite? Used to be editor of The Economist for a number of years, and he is now editor in chief of Bloomberg. Got a little bit of hassle about that. You can see about how he covered Bloomberg and that whole decision when Bloomberg was a candidate for president. And it's a really interesting book. And after what happened in Texas last week, I hope Texas got a wake-up call. But you'll enjoy the conversation with Adrian and John Micklethwaite for sure.
Right on. That's Thursday at 10 on our usual live stream place. Hope to see you all then. Jim Falk, thank you so much for your many observations, and thanks for joining our board, and looking forward to many happy conversations and so on when life resumes at some point.
Bye, everybody.
All right. Bye, everyone. Take care.